Please introduce Dr. Peter Dorsher. Dr. Dorsher is physical medicine and rehabilitation consultant at Mayo Clinic, Florida, as well as assistant professor of physical medicine and rehabilitation, and will be speaking to us about back pain cases. Dr. Dorsher.
Thank you. I admire your tenacity for being here. I have no disclosures. And I'm not only last, but I have to talk about back pain. And as we know, many of my colleagues even would rather not hear about back pain too much, and they're happy to check a box to send to the spine center, which is good for me. So what I'd like to do is just quickly review the importance of back pain in primary care practices, and then talk about the clinical practice guidelines quickly as well, and in particular, the red flag screening for serious illnesses in back pain patients, such as fracture and malignancy, and discuss why these red flags aren't really all that hot. And then I'd like to talk back pain cases with a different paradigm, looking at these individuals as having either mechanical back pain or non-mechanical back pain, which we'll get into, and whether it's anterior or posterior spinal pain. And I think this is something you can take home and use Monday in the office. And as we know, back pain is a very common issue among all of us, and accounts for about a quarter of all primary care visits, or our Rochester experience with over 4 years and 142,000 patients, it was 24%. So these people are coming whether we like it or not. Moreover, it's an expensive problem. Back in 2006, CATS did a survey and found that there was probably about $100 billion a year being spent on back pain. Well, 2/3 of that was indirect costs, but about 1/3 direct costs. Furthermore, compared to age and sex-matched controls, these people are sicker. They have more musculoskeletal pain, more neuropathic pain. They have depression, anxiety, and sleep disorders, which isn't too surprising for anyone with chronic pain. And more importantly, nowadays, especially opiate and tramadol use is quite a bit higher in these individuals, and that's going to become a big bugaboo July 1st. They use more NSAIDs as well, and that has deleterious effects, certainly on renal systems and elsewhere. And just their cost of care is higher. So there's been the so-called red flags proposed for cancer and fracture screening in low back pain patients coming into the office. And there's probably actually about 21 guidelines by different organizations, including the American College of Physicians, American Pain Society, and a variety of organizations from Europe, Australia, and Asia.